Welcome to the RN Mentor Podcast. I'm Dr. Ali Tayyib, nurse, educator, advocate, and United States Navy veteran. This show is about real conversations with nurses moving the profession forward. We discuss leadership, practice, policy, research, and more. What matters and why it matters. I'm glad you're here, so let's get started. Hello, and welcome to another episode of the RN Mentor Podcast. I'm super excited to be joined today by Dr. Justin Gill. Dr. Gill currently serves as the president of the Washington State Nurses Association. He is the first person of color to hold the role and one of the youngest presidents in WSNA's history. Dr. Gill has been an active member of WSNA since graduating from nursing school in 2012 from Whatcom Community College. He has held various positions on WSNA's Legislative and Health Policy Council and WSNA's Board of Directors. Nationally, Dr. Gill is a former trustee of the American Nurses Association Political Action Committee. In 2014, he received the ANA Nurse Advocate Award alongside Senator Susan Collins of Maine. During the COVID-19 pandemic, Dr. Gill made numerous appearances on live segments for MSNBC, NBC News, and CBS News, discussing his experience as an urgent care NP and commenting on the direct clinical impact of national policy decisions. Dr. Gill is a passionate health policy advocate and believes nurses are best positioned to make positive changes in our healthcare system. He feels strongly that nurses possess the skill to address some of the most complex problems that face our society, especially in an era of social and political instability. Dr. Gill obtained his Doctor of Nursing Practice degree from Yale University after completing his family nurse practitioner training and MS in nursing from Georgetown University. He obtained his BSN degree from the University of Washington, Bothell. He has held faculty roles with the University of Washington and Washington State University. Welcome to the show, Dr. Gill.
Thank you so much for having me. I really appreciate it.
Thanks for being here. So I first saw you during the pandemic era, where I saw you like all over TV, and I was like, I need to connect with this person, and luckily here we are now connected. So I've been following your work for years, and I have to say, extremely impressed with how you have really taken the skill of nursing and media and policy and kind of combined it all together. And really you put yourself out there. So that for me has been fantastic to see, because you're really representing the profession as a whole. So I appreciate that. So thank you for that right off the bat. But we'll talk about all your work in a second. But let me start with kind of your origin story. How did you get started in the world of nursing?
Yeah, thanks. And I think that, part of this is nursing has really kind of become a part of my identity for a number of reasons. And a lot of it actually had to do with, when I had initially graduated high school, I remember, I was really kind of certain that I wanted to, go into political science, go into law, was very, motivated by policy change. At that time, we were coming up on the 2008 election. And as someone that was, going to be voting for the first time in that election, I was really excited and engaged at, what could be the possibility, what could be the future, and what are ways that I could make an impact. So interestingly, I really kind of started out interning for I was living in California, in the Central Valley, and interned for my Congressman Jerry McNerney in Stockton, California. And this is just after graduating high school. I really wanted to kind of start getting involved and kind of enmeshed in that world of policymaking, and what the process really looked like. And that was also the same year that there was the 2008 recession. And being in that district office during that period of time, I really got to see firsthand at how a lot of these programs really made a difference in a lot of people's lives when it came to, say, Medicaid, or Medi-Cal in California, Medicare, access to federal programs, VA. These are programs that made a major difference in people's lives. And I think I kind of saw Stockton was one of the hardest hit by the recession. Actually, the House Financial Services Committee had a hearing in Stockton, California, which was kind of, I feel like, the epicenter, at least within California, of that foreclosure crisis. Um, and it really kind of gave me a perspective of how the world around people affects their ability to live, thrive, and be well. And actually, my sister was a nursing student. She was in the nursing program at San Joaquin Delta College in Stockton, California, where I was also living. And I I really was actually I was always interested in anatomy, physiology, and kind of the science as well. I took, anatomy and physiology in high school, and I I was kind of at a like stance. I was at a crossroads where I really I felt like I had to decide between policy, advocacy, and then going down the road of healthcare and nursing. Um, and I had a lot of, I feel like, mentors, but at the same time, I kind of navigated towards nursing and healthcare. Um, and I think there were two reasons. One, there was an economic argument for doing it, and especially in that economy. But two, I felt like it really kind of helped guide me towards that role where I could make that difference, where I could um, play a major role. And at the same time, I saw, leaders at that time that were nurses that were still making significant changes in a policy setting, in a policy role. So I actually made a switch when in my first term in community college. That's where I started out. And I started working on my prerequisite courses in nursing. And even during my nursing program, when I had eventually moved up to Washington State, um, the the leadership and kind of advocacy piece was still there. And I ran to be the vice president of the nursing students of Washington State. That kind of gave me that connection with my state professional association, the Washington State Nurses Association. Um, and then I had more mentors within Washington State Nurses Association, people like Judy Huntington, people at the federal level, and I was connected in with various leaders and mentors there. Um, and then right away when I graduated, I joined the Legislative and Health Policy Council for WSNA as soon as I became a member, and that really was, I feel like, an important moment for me because that was when I was just getting started as a brand new grad registered nurse. And at the same time, there were so many issues going on as far as staffing, meal and rest breaks. And it kind of gave me this avenue to be able to work on those issues that were affecting my ability to care for my patients, while at the same time still learning how to be a brand new RN. And they really complemented each other. I feel like it helped with my ability to feel fulfilled in the work that I was doing. So I would say that moment really helped solidify that, yes, I chose the right profession. It's exactly the right fit for me. I love taking care of patients while at the same time being able to impact the issues that affect my ability to care for my patients at a broader level. And that's really carried its way through, even in my role as a nurse practitioner. That was the first year that the Affordable Care Act rolled out, the exchanges rolled out. My first week of having a patient or seeing patients, I had patients coming in with lists of health issues because they hadn't been addressed for years. I saw patients that we caught colon cancer, breast cancer in that first week because of screenings that were now accessible. Um, and so I think that that's what's really kind of kept me going, and that's what's made me feel that the relationship between advocacy, policy, and visibility really kind of is synergistic with what we do as nurses and what our roles are, and ability to care for patients.
I want to kind of just step back for a second.
Hmm.
You went through a community college, and I have to, I've said this before. I sort of drank the Kool-Aid when I first came into nursing about
Hmm.
bachelor's degree being the entry level basic for nursing, right? And I'm not on that. I have since detoxed from that Kool-Aid. Uh, but because it really is an entry point for so many individuals and incredible nurses who, whether they decide to stay at bedside and that's going to be where they end their sort of their academic career, or they've moved on like you and are now doctorally prepared. How do you think that associate degree program influenced what you do now, um, overall? Because the experience isn't, it's not a 4-year university. It's not all of that. I mean, it still takes a lot of individuals, like 4 years. You have a couple of years of prerequisites, a couple of years of nursing program. It's still a long academic commitment. People just don't always see it that way. But how do you think your associate degree program influenced who you are now as an individual and a professional nurse?
Yeah, I think I'm very proud to be an ADN grad as far as my initial entry point into nursing. I felt like the quality of the program was very, very good. I felt like the hands-on skills components were great. Obviously, I think in any nursing program, whether it's a baccalaureate level or an ADN, it's an overwhelming experience for students. It's a lot of content that's really packed in. But it gave me this awareness of the fact that, nursing is an entry point for everybody. And the ADN process does make it much more accessible in many ways if the slots are there and there's faculty there, um, because it's oftentimes more affordable. You're really kind of ingrained in your community. The oftentimes, so for example, in Bellingham, there was a few community colleges that were really kind of doing their rotations at the local hospital there. Um, and so I feel like there are advantages to that because it gives people that step to where they can start working as a nurse, and grow their career and build their skills. Because to be honest with you, when you're starting out that first job, whether you finished an ADN versus a BSN, you're still dealing with the same challenges and the same learning curve and the same transition to practice issues. And I was the same way. I kind of also drank that Kool-Aid as well, where I felt like, oh, yes, we have to do this. We have to make that entry point at a higher level degree. And a lot of that was really not based on my experience as an ADN grad. A lot of that was based on the perception of nursing. And the fact that our jobs oftentimes are very, very complex. And they use a lot of skill sets from various professions and they overlap with a lot of professions. Um, but at the same time, I really looked at it as, is this accessible for everybody? Are those 4-year programs, or when we look at issues of equity and accessibility for folks to be able to advance their careers, the ADN program is an essential part for so many people, even like myself. I didn't have a lot of money to go to a 4-year college right out of the bat. I remember when I graduated high school, my parents, who personally, I'm a first generation college student. Both my parents were working class, and while they never said no at going to a 4-year college, they did bring up the aspect that the community college was a great way to get a start on my education at an affordable rate. And so, I know that like those kinds of stories are not necessarily unique to me. That's very common amongst a lot of other people. And I think the more that we always talk about having our nursing profession represent the people that we're caring for. Well, a good portion of them are also represented by those peoples and those stories that come through the ADN programs. So I think really the focus needs to be on not necessarily replacing these programs, but how do you support these individuals as they are starting their journey as a brand new nurse, and also giving them those tools and pieces and resources to be able to continue with their career in the way that they would like to.
Yeah.
Um, that's, I think, the key piece for me.
Yeah, I agree. Creating those like bridge programs or support systems so they can
Yeah.
continue to grow. Because as nurses, we need to continue to grow in our specialty, but that
Mhm.
doesn't always translate to another academic program. Sometimes it's in different ways. And I would have been an ADN program, except none of the ADN programs I applied to accepted me. So that's how I did not end up in an ADN program, but not for lack of trying. Um, so thank you for sharing that. Now, what because you being sort of politically engaged, right? It's not something like most nurses that are, including myself. When I graduated, I'm like, okay, I need a job, I need to get paid, I need to whatever, whatever, right? But what was the component that sort of drove you more like I need to be more politically active? And I know you touched that a little bit already, but like what made you say this is going to be part of my professional role
Mhm.
or identity in nursing?
Yeah, I think I've kind of changed actually my way of kind of my journey through this because I looked at it and called it, political activity, which I really see political activity and nursing as very, very similar and
Mm,
very aligned. When I see a patient and there's something going wrong with their insurance company or their coverage of a medication that I'm prescribing, or when I saw an error in the hospital or situations or structures and policies in a hospital setting that were affecting the care outcomes for a patient. What did I do? Well, who did I talk to? Who did I advocate to? How did I structure my message? And I think that piece oftentimes gets lost when we talk about political engagement and political advocacy in nursing. Um, and so that was kind of one piece for me. And obviously I had kind of an inclination and a real big interest in political science because I just had always really an interest in social science and how we behave as humans, how we interact, how do we learn. Um, and that actually plays a huge role in my ability to be a good nurse too, is how do I see a different type of person every, 15 to 20 minutes with a different life story, a different personality. And I find that interesting at a very local level and an individual level in the exam room, but at the same time at a larger level, human beings are. I feel like we never get bored of surprising ourselves with how we can navigate situations. But um, yeah, I think for me, in my nursing journey. I was always somebody that like, oh, I don't like this process. I don't like this policy. How do we fix it? Right. And I think it's that step of taking, okay, this is what we don't like. This is what the issue is. And how do we actually address it? I was really actually inspired because when I started my nursing career in that first year when I was on the legislative council, the number of nurses in our state legislature actually it went down I think to six or five, but at one point it was nine nurses in our state
Wow.
legislature, and they a lot of them were practicing nurses because we have a part-time legislature, and that also kind of solidified for me, oh my gosh, yes, these are people that can be in those back rooms when we feel sometimes powerless because say hospitals or larger institutions or special interests may potentially have those voices. Nurses also get a lot of respect in the legislature because people really want to understand what they think on almost everything that's healthcare related. Our former chair of our House Healthcare Committee is also a nurse. She's retired now. We actually don't have any actively licensed nurses in our state legislature. Um, but that really kind of reinforced that we are involved almost at every single level of healthcare delivery. And if you think about it, it's almost in every area that healthcare services are delivered, nurses are there. So we really should have the largest and at least some representation at that policy making level in order to make sure that our profession continues to move forward. We're able to do right by our patients and our colleagues, and we're able to make change. I think it's that step of I'm frustrated by this is what the situation is with our healthcare system and where we are as a society, and two, what do we actually do about it? And sometimes taking that leap can be difficult.
Yeah. Um, just because, I think nursing is a little bit underrepresented because we do
Mhm.
touch, and if you look at anything, everything has a healthcare component to it. Housing has a healthcare component to it, education has a healthcare component to it, food and nutrition clearly, all that stuff has a healthcare. So all the pieces that, job rates being up or down or anything like that has a healthcare component to it, right?
Mhm.
So um, how do we get, and this is, based on your experience, how do we get more nurses engaged? Because one thing that, which is, a little bit different than California, WSNA is also a union in the state of Washington and representing from the American Nurses Association perspective,
Mhm.
the larger body of nursing. So from and having just spoke at your convention, and thank you again for the invitation to do that. Um, how do you see, like you had a good number of individuals that are very active
Yep.
politically and representing nursing, making sure nursing is moving forward in the state of Washington the way it's supposed to be. And uh, but how do we get the larger body of nursing more engaged? Because a lot of the stuff, it's a hit and miss whether a school is a little bit more like covers a little bit more on how nursing is political or how nursing
Mhm.
influences politics, policies, and things like that. Um, but how do we get that message across a little bit more widely so more nurses are engaged, not only in the profession of nursing, but on in the area of policy, so they're actually making changes. Because some people, from my perspective, it's great to be politically active, but if the policies aren't following
Mhm.
those activities, if there aren't dollars that come after that that can support that move or shift or change, whatever it is, it's not gonna that change is not gonna happen. So from your perspective, your experience, how do we get nursing more engaged in that piece?
Yeah, that's the big question, right? I think that I think a lot of it comes down to perception of politics, policymaking, and obviously the perception I think has changed recently in the past. 4 to 8 to even 12 years. Um, I think that people, it's all about, I think, reimagining what it is that your potential is as a registered nurse. I think that the profession has made some great strides in our ability to reimagine what is nursing. Obviously being at the bedside is one of the things I love and is still a part of my practice, but you can be in a role where you're leading a hospital. You can be in a role where you are leading, you're running for office. You can be in a role where you're appointed to an agency. And part of that has to do with, I feel like, role models. I know that, at our convention, you talked about sponsorship, right? And we actually talked a lot about that even after your talk. And part of it is nurses being able to see themselves in that role, in that advocacy piece, making a difference, making a change. And what I usually will say to nurses that I've tried to mentor and help kind of guide them in their journey, because they've had a significant increase or an interest in political advocacy and making a difference. A lot of them are nervous about, okay, well, how do I do this? This seems really overwhelming. I wasn't prepared for this in school. Well, the answer to that is yes, you were prepared for this in school. Uh, I remember there was a lawmaker, I can't think off the top of my head, from North Carolina that I was at an AANP health policy conference, and she said, it's a lot more difficult to talk to a newly diagnosed type 2 diabetic about, the next steps, about their diet, about what this diagnosis means and what their next, what their journey is going to be like. That's a much more difficult conversation oftentimes than having a discussion with your lawmaker, or even going to if you're in a lawmaker role, being at a hearing where other people are testifying. Um, and I think if you remind nurses that the work that they do, especially if they, still caring for patients at the bedside, that work on a day-to-day basis is oftentimes much more complex than a lot of the issues we're facing kind of structurally and nationally. And a lot of those skills are translatable to that broader level, and mentoring them on that and supporting them. We could have, a good number of nurses in the state legislature and city councils and our federal legislature, in appointed positions. Um, but we have to imagine ourselves in those roles, and work towards those, and work together as a broader community to do that. And then there's the piece of, I think that the identity politics of our time really interfere with people's perception of what is political engagement, right? I think there's been criticism from national group or of national groups that, there's this kind of false neutrality of, well, we have to we have to appeal to both sides equally, and that I think issue base and our foundation needs to move with where the politics are. So we have to endorse this number of people from this party or this party to make it look like we're bipartisan. Um, when my approach to this has been parties and political institutions change over time, but our values in our profession don't. And really, we should be talking to both sides about what our priorities are, what our experiences are like, what our issues are, and what our values are. But at the same time, not compromising those values to produce an appearance of neutrality or bipartisanship,
Yeah.
because our values are what get us through, right? It's not pandering to, in our hospital setting, it's not, pandering to one particular ideology or not. It's what is right for the patient. And that's, I think that I feel like if we had more nurses approaching things like that, we would have the ability to kind of break through some of the, I think, the noise that clouds our political process and also makes our political process seem a lot less appealing.
Yeah.
And so I think it goes back down to our foundation as nurses. We have the skills and the ability to connect with people from various backgrounds, various political ideologies, various, social experiences in their lives. And there's not a lot of groups that have that kind of unique ability to do that in very difficult situations. So it hopefully that helps us reimagine how we can apply those principles to our ability to be politically active and make a difference.
Yeah. And based on that, so this is something I've had personal
Hmm.
conflicts like internally with some of the larger organizations
Hmm.
that represents nursing is exactly that they're they they come out and they speak about this neutrality and how they have to work with regardless of who's in the office and all of that. And I agree with that. They need to be able to do that. But the component of neutrality has, for me, doesn't quite work because, as you mentioned, we still have our own values and we still are always speaking to the same issues, which is the issues that we see within the communities that we're serving, regardless of whose, ethnicity, political, affiliation, anything like that, right? So we're always speaking to that component. And I guess my personal conflict has always been and continues to be is how well organizations are communicating that with the nurses that they are representing, right? There just isn't seems like in the world of social media, in the world of email and technology and all of that, like by the time the message gets to me, it is months past and it's so polished and sterilized that I am no longer interested as an organization what you're saying because I'm like this. So how do you address that? And I don't know. I don't know how, like, for example, you and the Washington State Nurses Association kind of
Hmm.
deal with things like that. I follow you guys on your social media accounts and I can see uh, you're probably doing better than most, I would say, in communicating things more timely and effectively, and really stating, as you mentioned, these are the issues that you're fighting for. But from my perspective, some of the national organizations are really failing at that. Because I can see I'll throw out the I'm gonna like when you look at public health sector, right?
Hmm.
They are when you look at national organizations, they are on it like almost immediately, and they put out messaging that is in line with their work, right? From the public health perspective. Nursing isn't doing that, and I call them out once in a while on social media, and once in a while they respond to me, but there's no national response. It just feels like
Hmm.
that neutrality of things. And it's always like, well, we have nurses with different political. I'm like, I get that,
Hmm.
completely get that. But how do we address the issue without politicizing. You can advocate for an issue without having to politicize it. It may be in disagreement with the current political party,
Hmm.
but it doesn't make the issue any less or more political, right? The issue is the issue.
Yeah.
So from your perspective, I mean, and you could just talk to like the Washington State Nurses Association
Hmm.
perspective. How are you guys addressing those that is making you, I would say, is making you a little bit more effective? Because at your conference, I heard that you guys mobilized like hundreds of nurses to write to their legislation, like within like
Hmm.
24 hours, I think it was, that changed a bill from a yay to a nay or something like that, right? So, like, how do you get that kind of communication and buy-in
Hmm.
from an organization perspective? Because I think some of our national organizations really need to step up. Uh,
Yeah.
and I know they have a lot of hurdles to jump through and legal things and lawyers and
Hmm.
all that good stuff. But still, I feel like we're behind the eight ball a lot of time. Like we're just not moving. We're not leading the way when we should be.
Yeah. I'm actually in complete agreement with that, Ali, and it for a number of different reasons. With WSNA, you had mentioned we are, a union, but also we have that professional association identity piece. And we've recently started, talking about that as, we used to say union members and professional members. Well, all of our members are professional members, but
Right.
there are people that, want to be a part of the community that are not necessarily represented by collective bargaining. And that's why that piece with, ANA and our national union affiliate AFT, which AFT is, with their leadership, Randy Weingarten as their president, and as an association, I mean, they do a great job of focusing on issues and leading with that first. And this really, I feel like for me has been something that's been growing, and it's been before, our current president and the previous president within our association circles. I think back, when you had mentioned I got the Nurse Advocate Award with Senator Susan Collins of Maine. Our association at that time, the ANA, in my opinion, and I've made this known to, I mean, you ask anybody in any of the other CSNAs, they know that I'm pretty vocal about this. And that's what I do like about the professional association, is that you don't always have to agree with the trajectory, and you have a voice and you have that ability to speak up for what you think would be the best path. But that was a time when I felt like ANA was fighting for things, and it was visible, it was palpable. When I did my doctorate degree, I did an internship with ANA in DC, which was a great experience. And that was also the same time when the Cassidy Graham proposal was coming up to repeal the Affordable Care Act. It was the repeal and replace, or the skinny repeal.
Right.
And I still remember I was there with the GOVA staff in the hearing room. We made our way into the hearing room. I have no idea how, but we were live tweeting. We were working in coalition with other groups to really up the ante and stop that bill from passing. And obviously thanks to some courageous senators who were from one part of the Republican side, that bill did not pass and it was stopped.
Yeah.
That's the type of visibility, that palpable advocacy that's focused on. We were not talking about politics. We were talking about policy. We were talking
Right.
about access. We were talking about the implications of this bill passing. It wasn't an attack on a particular political party. Um, and I feel like that motivation has kind of been lost. Not just with ANA, but a lot of other health professions. You look at the medical association, you look at hospital associations, and it's especially in this time where a lot of groups are really fearful about the potential of retribution in our politics and what you say. Um, and so, from WSNA's perspective, at least, as I've served my first term as president, but also I look at myself and my leadership as a reflection of what WSNA's history has been, which has always kind of been to ruffle the feathers a little bit, and speak truth to power. And there's a lot of leaders that have kind of laid the foundation for where I'm at now because of that ability. And so even coming up on this recent election, which again, I think people bring in a lot of factors that were, not necessarily a part of this decision making. It's pushing the message that our values come first, no matter what, and that as an organization, you're going to have members that are going to either agree or disagree with, say, a political party in their entirety, right? Whether it's tax policy or certain policies that you might align with a particular political party. But when it came to healthcare access, union rights in this election, my state association, amongst others, really advocated that our national association needed to have a voice in our election this time. And unfortunately, that push was unsuccessful, and Washington State Nurses Association did endorse Kamala Harris for president in this past election. And I also remember getting a lot of not necessarily this perception that, oh well, Washington State is it aligns one way politically, which is not actually accurate. It's, our state senate was actually under different party control for quite a while, but the fact that, oh, it must be easy for you guys to want to be able to do this because it's, everybody agrees with you. Well, that's absolutely not the case, right? I expected and I encouraged people to reach out when they disagreed with that decision that I knew was the first time we made that type of decision in our history. And what I realized is that we need to have more conversations with one another.
Yeah.
And once we had those conversations, obviously I didn't get everybody to agree, but we agreed that for the organization, for the profession at that time, and looking at the platforms for the different candidates, that this was the path we needed to take, and especially in this moment where we needed to use our voices. And I think that needs to be applied at the national level even more now. We're seeing, I remember I was just looking just a few weeks ago when I needed to access resources on our CDC webpage for treatment of sexually transmitted infections. The webpage was down.
Mm.
When I see that my HHS office here in Seattle has been shut down. Like, these are actual things that are impacting my ability to do my job, and I know is impacting the ability for other nurses to do their jobs. And if we're afraid to say anything about that in a very public way and leverage that trust we keep, highlighting, and leveraging our numbers that we keep highlighting, and we don't cash that leverage in at some point when our public really needs us, then we are going to lose that trust because it's going to look like we kind of just caved at that point.
Yeah.
Um, and I also think there's this piece. So, like, people will say, I'll get a lot of criticism whenever I speak up about, our national groups not saying much, is that, well, you don't have an awareness, there's members that, say voted for this president, and any kind of action that we say would seem against them, we're going to get flack. Um, I actually think it's more important for us to be able to lead with, we disagree with taking our health agency websites down. We disagree with cutting Medicaid because it's going to impact some of the most rural portions of our country. Not everybody agrees with what one party does or what one president does. If anything, it's more powerful to lead with the issue and having people that may have voted for this current president saying, hey, we disagree with this. That in and of itself could even be more powerful. And I think we really have to kind of get out of this mode of kind of coasting and surviving. The rules of the game have changed in our political system. And I think that we're going to get lost in that process if we don't keep up. I think visibility is key. Being able to connect with people at a level that they can understand is key. And knowing who your membership is, I think is really, really important. And I think the final thing I would say about this is, you mentioned the Public Health Association, with Secretary Kennedy, and saying these are the harms of some of the things that came out. There was nothing political about that. It was just quoting, what he was saying and what the impacts were on public health. That's what we need to do more of. And I think my biggest message for professional associations right now, it's to do something. Stop putting the finger in the air and seeing which way the wind is blowing. Stop trying to keep your powder dry. That's what I hear from a lot of leaders, because by the time you're trying to fight back, you're going to be falling. So I think we really have to kind of keep our eyes on the ball on that.
Yeah, I agree with you. And it's been I want to say something like 10 years or so since the ANA stopped endorsing
Mm-hmm.
a political candidate.
Hmm.
For president. And although on one hand, like I didn't agree with it in the beginning, I still don't agree
Hmm.
with it, just for the very reason that you mentioned, is we need to be able to support candidates that are aligned with the work of nursing, which is really the advocacy for an entire population of the entire nation, really,
Hmm.
and an entire nation's health in various aspects, whether, like I mentioned before, whether it's housing, whether it's access to care, whether it's equity, any of that stuff, right? So
Hmm.
we definitely have a code of ethics. There's a brand new book about it that ANA is actively trying to sell online because I see it
Hmm.
in my feed all the time in social media, which is fantastic, which is great. But I even said it online a few weeks ago or something like that. I'm like, this is fantastic. I just need ANA to step up and live
Hmm.
this code of ethics. Not that they're not necessarily, but their voice is definitely, and I've shared this with them before, their voice is definitely
Hmm.
not being heard.
Hmm.
They're not being loud enough. They're not being in your face enough. And I think we live in an era right now where trying to be, what's that social media thing? Trying to be like demure about it is not going
Hmm.
to is not going to cut it, right? So I think we definitely, it doesn't have to, you don't have to be a like a I don't even know how to even like say this anymore without being censored, but
Hmm.
but like how do we continue to engage with a stronger voice, right?
Hmm.
And I think that's the piece that's missing. We're trying to, as you mentioned, we're trying to play by the old rules where everything was sort of politically correct, and but the rules, as you mentioned, have changed. So we need to change with the times. Otherwise, we're not going to be the most ethical and trusted profession anymore because people are not going to see us as advocates for them anymore, right?
Hmm.
If we're
Yep.
just going to be chasing these where the dollars are coming from, and I think that's where everybody's kind of taking a bowing out in some cases is because they're looking at their pocketbooks.
Hmm.
So it's unfortunate, but we're already seeing a lot of the damage, as you mentioned. Some of the resources have gone away. Some of our scientists have gone away,
Hmm.
and it's definitely going to impact the profession. Whether we just, I hate to say, we kind of sat on the sidelines.
Yeah.
Um, uh,
Well, I think
but
that speaks to, I think the because I was on that task force actually, that the ANA Presidential Endorsement Advisory Task Force, which was a very I think interesting process to be a part of. And one of the compromises that really kind of came out of that was, and the reason why we had, because I think there was a lot of advertisement of the fact that this is what the membership wanted. Well, the membership got to that 90+% approval of that policy because there was an understanding that in a situation where, say, the ANA board of directors and the leadership felt that an endorsement would be necessary based on the dynamics of that time, that was still an option, that it did not necessarily rule out the possibility of endorsement. It removed a prescriptive process. Unfortunately, I think that the perception of that change was that we do not make endorsements anymore. And while I agree in certain times endorsements can have limited value, there are also times where taking a stand is essential to make sure your members are feeling like you're fighting for them,
yeah,
even if your efforts are not necessarily successful, especially during these times when we're seeing so much happen at such a fast pace. Um, you may not be super successful at this moment with every policy initiative that you have, but your strength comes from the engagement and the power of your numbers and who you represent. And if you lose that connection with those people that you represent, then your ability to influence changes when you have the ability to do that significantly decreases.
yeah,
And so that, again, I think it's in, I'll take this because I hear this from Dr. Monica McLemore all the time. It's, we don't lead with fear. We should
yeah.
not be leading with fear, and we never have as nurses when we see patients at the bedside. Let's translate that to the broader level and not lead with fear, lead with courage, um, and lead with our values.
Yeah, I agree. I agree. Yeah. and Dr. I have a lot of quotes from Dr. Matt McLemore in my head. I've spoken to her multiple times. I've heard her speak in public, and yeah, and so yeah, yeah, so she's definitely leading at this time. I
Hmm.
want to say more than some of our national not.
Hmm.
She's definitely leading probably more than all of our national organizations. So
Yeah.
yeah, she's a great advocate for nursing and many causes.
Hmm.
Um, we're almost out of time. I want to make sure that I give you enough time to anything else you want to share about either WSNA or your own work. Would love to hear about it.
Yeah, I want to again, thanks for having me on, and I really do enjoy this podcast because I think it's absolutely needed right now. We're dealing with the next generation of nurses, and we're dealing with a tech age. We're dealing with significant policy, social, and I think structural change in our healthcare system. Um, and I think that I guess my closing kind of message would be for nurses to engage more in this way and listen to these podcasts, join these types of podcasts, joining your state association, even if you feel like it may not be going the way that you would imagine or envision yourself, put yourself in those positions, run for a position. If there's ever a time to really kind of take a risk, if you're in that position where you can kind of lean in to some of these positions that might seem uncomfortable, at least initially, now is the time to do it. Because the times are changing, society is changing. Nurses have always been trusted, and we need to continue to be in those roles where we have a voice. And so I think that's kind of been my passion for in my roles with WSNA. But I would definitely encourage folks to get involved in a group, in an association, in your nursing associations, and help speak up for what you think is important, not just within those associations, but at a national and local level.
I appreciate that. And running for office or running for a position can be quite intimidating for a lot of
Mhm.
people. So just you made a question pop into my head. What is
Mhm.
WSNA doing, or what is some of the other organizations that are
Mhm.
what are they doing? I would say well that are engaging and supporting nurses who are thinking about running for office, whether it's at a local level, at an organizational level, or on a national level.
Yeah, so WSNA actually does engage with a lot of state groups as far as giving people the tools and kind of I think the mentoring and the resources to be able to at least think about what you need to do when you want to run for office and that more formal process. There is actually a national group that I'm going to be attending their campaign school this July, I believe it's called Healing Politics. And it's led by actually one of my faculty advisors in my DNP program at Yale, Dr. Lisa Summers, which really kind of I really am excited about it because it's not just a campaign training school; it is a campaign school for nurses and midwives, and
Wow.
it really helps nurses be able to kind of connect the skills they have into becoming a viable candidate for office.
Wow.
And I think we do need a lot more programs like that because we would see a lot more nurses in elected office or in leadership positions. So that's the one piece I have a lot of optimism for, is I am seeing a lot more nurses, especially in my generation and newer generations, and actually in generations before me that are thinking, "Hey, I can do this." And that definitely gives me a lot of hope and optimism for the future.
Appreciate it. Well, if you ever decide to run for an office where I can vote for you, you have my vote. So
Thanks,
thank you.
Holly.
All right. Well, thank you so much. Again, greatly appreciate your time. We have been listening to Dr. Justin Gill and the incredible work that he's doing. Thank you again for being on the show. Looking forward to bringing more incredible colleagues to this podcast in the coming weeks and months. So thanks everybody for listening in, and we'll talk again soon. Have a great one.
Thank you.
Thanks for joining me on the RN Mentor Podcast, a production of RN Mentor Consulting. Please don't forget to follow and check out rnmentor.org for additional content, speakers, podcast notes, and more. Until next time, fair winds and following seas.